Dr. Sayone is a board-certified physician in public health and preventive medicine with a distinguished public health career that started in New York City's Department of Health and Mental Hygiene as the medical director of tobacco control and chronic disease prevention. He joined the County of San Diego Health and Human Service Agency 10 years ago as the county deputy public health officer and public health services. Most recently, he worked as the public health medical officer within the Medical Care Services Department, where he led the HHSA justice-involved health efforts. He served as a liaison with health and justice partners to improve care coordination for individuals before, at, or after incarceration, as well as collaborating with community, justice, and other partners on various initiatives to prevent and reduce incarceration. He supports the county's response to the Tijuana River Valley transboundary sewage and pollution area crisis. So he's going to be a great source of information on that for us. He holds a master's in public health from the Columbia School of Public Health and a medical degree from NYU. He has been recognized with numerous awards, including the San Diego County Top Doctors Award in 2022 and an Emerging Leaders in Public Health Award in 2018. And we are so grateful that you are here today to help us talk about the impact of extreme heat and wildfire smoke on human health.
And
So welcome.
thank you so much, Mary Lou. And really, it's an honor and pleasure to be here with you all. I know the work that you all do nationally. I'm not as familiar locally, but I will say that just speaking of environmental, and Tijuana River, I sat in on one of your calls with Dr. Prather from UCSD, who, by the way, is about to publish in like a week or two another pretty big paper. And I know she and her team, they're inviting me to one of the preview meetings. And so just really appreciate, this is the Tijuana River is our, and the exposures to raw sewage and the other chemicals and pollution that's associated with that from the river or from the beach, frankly, from the ocean and the south swells coming up, and, is the reason for the county to have declared or proclaimed an emergency, a local emergency that's been going on for 2 years now. We've had a local emergency proclaimed.
Forever.
All the cities that are most impacted have also done the same. So this continues to be an all hands on deck approach. I would be more than happy if you ever want me to talk about, like, we just got results from the federal ACE survey back maybe a month ago, and we started doing those rounds, so to speak. I just spoke to the Air Pollution Control District Board on Thursday about those results. So more than happy to come back to that. And I've always had I'm kind of passionate about everything public health, but environmental health, of course, has always been something that I'm just personally passionate about. And Adrian knows this, and Gayla, that climate change, even in my public health school, they allowed us to take courses for free and audit courses in the School of International Public Affairs. So I took climate change courses to better understand, what all the controversy was about, et cetera. And even as deputy health officer, we were dealing with certain environmental issues like a plume under Magnolia Elementary School and, the impacts to that to the school and things like that. So, I particularly am interested in this space that you guys work in. And I really, you ladies work in, sorry. And so I particularly am interested in. So glad we can hopefully leverage each other's passions and to move forward and move the needle on some of these things that in a meaningful, impactful way. So I'm going to share my slides, and then please let me know if you see them. Okay. Do you all see that?
No.
No. Okay.
Yeah.
Now we got it. Thank you.
Great. So, you know who I am. And again, many thanks, as Mary Lou mentioned, to Adrian and Gayla on these slides. That's okay. There we go. So, I'll talk about, we're only going to focus on two of the kind of content areas when it comes to climate change impacts. If you're interested in others, we can always come back for more. And then what are we doing as a county? But of course, what we do is never alone, which is why we're here and why we need to leverage each other and partner. And then, of course, open up questions and answers later. So I think given that the group and the subgroup of League of Women Voters that's in front of me, you probably already know a lot of the why. So I don't have to really spend too much time on the justification, but I want to tell you from the healthcare and organized medicine perspective, it is really fascinating to see the development and the buy-in of the organized medicine into supporting and identifying this as a public health crisis, meaning climate change is a public health crisis. Because I will tell you, when I went to medical school, the organized medicine groups that you see here, like American Medical Association, we're not leaning into this topic. So it really makes me and a lot of other providers happy to see that they are proactively taking a stance. And you see in 2019 there was a letter sent and signed on, essentially just adapting that policy in 2022, declaring that a climate change was a public health crisis. So from a medical perspective and a broader health perspective, we are all on board and agree that this is something not just impacting the world, but impacting our livelihood, quality of life, and actual life expectancy in some instances as well. So how climate change impacts health, sorry, let me just move this. Okay. So as you see here, and again, I think this is obvious to many of you, there's many ways that impacts health, human health, and through environmental exposures and things that we deal with here in San Diego and California, which are wildfires and smoke, increasing in allergens, which seems like a nuance to some people, but there's a subset of the population that have very severe allergies. And so for those individuals, to move the whole a group of individuals who are already suffering to suffer even more is a significant impact, and not just a little minor quality of life issue, so to speak. So and then of course alter the environmental conditions when you're changing the landscape and allowing things to occur that have never occurred in San Diego in our climate, which has kind of been stable and over decades, but now it is a climate that is allowing new types of, for example, mosquito-borne diseases or mosquito-transmitted diseases to occur, which traditionally or typically used to be only transmitted in tropical areas, but are now here in San Diego County. So I love this image, not just because it's colorful and beautiful, but also just because it summarizes a lot of critical information at once, right? When you're talking about the impacts of climate change on human health, what you're talking about that's causing those changes and impacts are rising temperatures, greenhouse gas levels, rising sea levels, and more extreme weather. And it impacts all of these kind of boxes that you see here, all these content areas. And we're going to talk about extreme heat and wildfires and smoke, but I want you to know that there are so many other impacts on that are much more broader and all-encompassing. And what else is all-encompassing is not just impacts on our physical health, but also our mental health. And I'm so glad that they called that out, because that is important, because that affects our lives, our livelihood, and quality of life as well. So specifically talking about wildfire, smoke, and air quality, I think the bottom line is that we know that our air quality, we have spent decades improving air quality in this country. Decades, right? We've put into many regulations in place. We both for industry and non-industry, we've improved things. We've changed to electric vehicles, all of that to be unfortunately reversed to a large degree because of the increase in wildfires. So you see here that there's hotter, drier conditions, and so you have the recipe for more wildfires to naturally start. And then when you get wildfires, that itself, is a large issue, not just because of the wildfire, but because of the effects of the wildfire and some of those are longer lasting, of course. So there's higher temperatures, also that boost ozone formation. There's longer growing season, which just contributes to more pollen, which gets back to the allergens. And so, when taking all these in totality, they have a significant impact on our physical and mental health again. So many of you know and know better than me, because I've only been in San Diego for 10 years, or in California for 10 years, that even when I got here 10 years ago, or fire season was a lot more narrower than it was now. And so now we say that it's fire season all year round. And you see here, hopefully you can see my mouse, that in this kind of red little narrow section, very typically or historically, California's fire season was through kind of April to May-ish through October. But that is not the case anymore, right? This is the new reality in which we live. And because the rainy season ends earlier, because we have long, hot summer that dries out vegetation, so you have more fuel, you have strong winds in the autumn, right, that fuel faster, hotter fires. And that's where you see those red flag warnings. And then rainy season begins later. So a combination of all those factors results in, unfortunately, pretty much a year-round fire season, unfortunately. And it's not just that we have more fires throughout the year and we're more susceptible to fires throughout the year, but those fires actually have burned for longer periods. When we look at the data, this is a legislative analyst office report from 2022. So I know we're missing a few years because even the years, it only goes up to 2019, but you could even see in this data that the severity of the fires is increasing, that the black part of each of those columns, you can see that increases over time, and you can see especially in 2019. But we all know that this only continues to worsen, unfortunately, when we look at this as a trend. So they've increased in frequency, they've increased in severity, and they've increased in duration over the last 2 decades, and we don't see this trend reversing at all. And we see that because of that, we're going to get more smoke emissions, which is worsening the air quality for everyone, not just in that area, right? Air does not have borders like we humans do, right, on land. So we unfortunately all suffer when there's more wildfires. And then what is in the wildfire that's actually impacting human health is important to understand as well. You have all types of particles, and really when you combust anything, right? When you talk about tobacco, right, the illegal addiction, as I used to call it, right, that you're combusting and you have combustible byproducts. And so you have all of these types of things that come out of whenever you're combusting anything. Even if I was to light my, I don't know, shoelace on fire, right? Like you would get some of these same combustible byproducts. Of course, it varies a little bit depending on what you're burning, or a lot bit, but still there are some commonalities. And so some things to consider is that when you have biomass that's being burnt, which is vegetation and wood, then you are going to definitely get things like particulate matter, and of different sizes. And particularly, we are concerned of some of these fine and ultrafine particles because they are small enough to get into like deep parts of your lung, and expose you to more kind of really expose your lungs and make you more likely to have other health effects. And then there's gaseous pollutants like you see carbon dioxide, monoxide, nitrous oxides, formaldehydes, benzenes, volatile organic compounds, and metals. And then we see that again the what comes out of a fire, and what is being produced, so to speak, does depend on various factors, including what you're burning, and then the conditions of when you're burning or when it's burning, if it's flaming or smoldering, and then the composition of your soil. But you see here on the left, I really appreciate this picture because it compares to a human hair, which we all know and can feel is pretty small. And then you see a particulate matter of 2.5 and 10 compared to that. And you can see how much smaller we're talking about. And so that's why you can then understand, or at least it helps people like me understand, how then that can easily be inhaled, and reach, deeper into our lungs. Then, of course, the way that we're building our houses, and as humans, right, we're building houses and technology and all of that, of course, has increases the potential of things that can be burnable, so to speak, right? So we have the greatest number of houses in places specifically that are what we would consider the wildland urban interface, the WUI. And so you see here, there's an estimate of 5 million housing units in this area. And more and more, we know that housing is an issue in California, but we also know that space is an issue. And so we are and do continue to build in places that are in that wildland urban interface. Unfortunately, with fires being, occurring at increasing frequency, this puts into a challenge and direct competition, essentially, our need to build more homes, but our need to protect ourselves from fire, right? So we know that there's smoke, and that from treated wood actually generates toxic fumes as well. So, and then you can see on the chart on the bottom left that increase in houses in the land urban interface. And then on the top left, you see many of the things identified in, like, commonly in households or in the garages or the vehicles, that do have components that easily kind of can contribute or catch on fire, etc. Okay. We know that San Diego County is the 5th most populated county. It's also a really, really large county, not the 5th most largest by landmass, but we have a lot of our county that is more rural, is in what we would consider also a very high fire hazard severity zone. So this is just by Board of Supervisor district maps. We know that even the parts that are more urban or suburban are also have areas that are in fire hazard severity zones. So just wanted to point out specifically District 2 and 5, just because there's a lot of more rural areas. We know, again, our air quality, and this is the point I was making earlier, we've made significant gains over time, right? For many of you may remember, or I have seen these images of, for example, Los Angeles, where there's significant smog and things like that, and so even though a lot of those conditions have improved, a lot of that air quality improvements have been reversed to a degree, or a large degree, encountered by all of the wildfire smoke that we are dealing with. We know that the frequency, as mentioned, of smoke days is continuing to increase. We know that a lot of the smoke, again, is composed or comprised of particulate matter. And we know that many people in California have experienced large increases in wildfire-driven air pollution. And again, we are not protected if there's not one right next to us. We know that air can travel. Here in our county of San Diego government, we have what's called a Live Well San Diego vision and framework that is part of the how we operate it and why we operate it, and really to keep our residents healthy, safe, and thriving. And as part of that, we actually have 10 indicators, Live Well indicators, and one of them is air quality. And so here, what you're seeing is that air quality is the ratio of days that air quality is related to unhealthy for sensitive populations. And you see the trend over time from, 2012 to maybe 2023 or 4. I apologize, but this is the latest data that we had pulled in 2025. So 2023 it goes up to, and you could see here that in San Diego County, the air quality was rated poorly for 5.5% of days in 2023. That's 20 days of the year that our air quality was rated poorly, right? And I know we're the finest city. We have a lot of things going for us in San Diego, but this is a significant deal. And we want to, especially if we look out for our most vulnerable residents in San Diego, because we know that this can impact respiratory and cardiovascular health. Then again, just to go further into the health effects of wildfire smoke, when we talk just about particulate matter, we know, and there's data to show, that it not just causes the throat irritation and the eye and lung irritation, because it can get into a lot of places, but it can contribute to asthma attacks, breathing problems, heart disease, and then premature death as well. So you see, I love the image on the right. That's a kind of an easier way to digest it from my perspective. But on the left, you see that, yeah, it's associated with mortality, all cause and cause specific mortality, and then morbidity as well, and has impacts on, very sensitive and special populations like pregnancy, birth impacts on our health and mental health, including cognitive impairment as well and mental health. Um, Here's another way and more detailed look at the health effects of wildfire smoke, not just particulate matter 2.5. When you look at it by category and you see from cardiovascular to cancer, pregnancy, lead, gastrointestinal, dermal or skin, respiratory, and mental health. I know there's a lot of information and you will have a copy of these slides, but I really like this table because it talks about what is contributing to it, what is toxic about those contaminants, what is the short-term effects and the long-term effects, because sometimes some things get the attention, and we're talking mostly about short-term effects, which is absolutely important to talk about, and we forget and lose sight of that these have long-lasting impacts, right? When people are exposed to bad air quality due to wildfire smoke. So we have to follow up on these individuals who are exposed, particularly, when we look at folks who in sensitive job classifications like firefighters and things that are maybe exposed at higher rates. And then, of course, the mental health. I've alluded to that a few times now, and we know that, whenever you're dealing with any catastrophic event, whether it's a wildfire or anything else, that it's absolutely logical and expected and to be expected, and we should plan for this impacting on our community's mental health. So we want to make sure we're prioritizing safety and health. We want to make sure people feel connected to their support networks and that people can practice self-care for themselves. But as a community perspective, you're dealing with people who sometimes have lost property, sometimes even lost pets or loved ones or other things, right? And it's not just their property, but they've lost memories and things like that, and financial hardship. And of course, there's the mental health of the folks who are participating, the responders who are dealing with and seeing kind of that trauma firsthand and the people who are experiencing the trauma, and experiencing what some people may call secondary trauma. And sometimes you're helping out, in areas, close to home, and your family's evacuating, but you're assigned and you're an emergency responder, so you're helping at the same time that the rest of your family is impacted and leaving, so, or evacuating and things like that. So you could be directly impacted as well. Another impact, not from a substance use side, is that there are easier access to substances and illegal substances or illicit substances in abandoned homes. And that does come up. And so that's something we have to be careful for. And access to things like firearms. These are things that we don't want to have unintended uses, but it's the reality that there are sometimes people who are looking at abandoned homes for some of these things and other things. We know that when we go back to physical health and respiratory health, that the effect on individuals, may not be the same, and may vary depending on who you are. If you have a pre-existing respiratory condition, of course, you're probably at higher risk, and more sensitive of a population when it comes to wildfire smoke or even bad air quality days, right? So we want children, older adults, pregnant people, people who have existing respiratory conditions to make sure that they are aware of when there's bad air quality, when there's wildfires, right? And also we want to add to that group outdoor workers, people who are unhoused, people experiencing homelessness. And then we know that there are other people at high risk for respiratory illness too, which include people living in urban areas where there's a lot of air pollution, and rural communities as well. And then we want to improve air ventilation. We want to do things like using, from a mitigation perspective, a port. If you're not required to evacuate, for example, but it's close enough or it's affecting the air quality in your community, then you could use a portable air cleaner. And there's a DIY air cleaner that I'll talk about in the next slide. But if you have a central air, then you want to run it, but you want to close the intake from the outside if that's possible, so that you're not pulling in the outdoor air. You want to just kind of refilter your indoor air so you're not getting exposed and pulling in the wildfire smoke. And then this is the DIY. I think it's genius. It's brilliant. You can see the sources EPA. There's videos online on how to do this. It's actually fairly simple. We actually have gone to schools and have shown people and students, how to do these DIY air cleaner designs. And it's there if anyone wants to reflect on that later. And of course, when there's wildfire smoke, we want people to limit activities. We want people to make sure they take proactively certain medication, so that in case they are exposed, that they're not triggered. Like you could take your maintenance or an extra or your albuterol inhaler. You want to talk to your provider ahead of time. Of course, you want to wear a mask. Sorry, call. You want to wear a mask. And this is not to prevent communicable disease, but to prevent to screen out some of those larger particles. But we know that masks can only help for with so many. And even if it doesn't screen out, for example, all the particulate matter, the smallest particulate matter particles, it may give you a lower dose than what you would have been exposed to without a mask. So that's also important to know. Now, switching gears, talking about the other aspect of climate change and human health impacts that I mentioned earlier on is extreme heat. So we know that excessive heat, in addition to wildfires, right, is also another impact from climate change. We know that over time, the trend and the data show that we are having higher temperatures and prolonged temperatures, periods of heat, and that is that's a reality again. That is our new reality that we are living in right now. And your body has a sweet spot. Your body has a thermostat, and it's set to the same number throughout your whole life. And so your body's goal is to maintain that sweet spot, that temperature, and do whatever it can to do that, to maintain that, right? So you're trying to sweat when you're too hot. And hopefully that sweat will allow some of that heat to dissipate. But in certain conditions where it's so hot or it's so humid or both, then it's harder to sweat. It's harder to cool down your internal temperature. So we that's why it's really important to do things like get into an air-conditioned environment, and other things to prevent conditions like heat exhaustion, heat stroke, dehydration, hospitalizations, and death, because we do have deaths. And when we talk about climate change, just to be clear, this is the thing that people are dying of the most. In the US, year after year, this is the thing. It's due to extreme heat and its impact on health. And then, of course, like everything, there are certain populations that are more vulnerable than others, but everyone is vulnerable to extreme heat. And here you go. Yeah, everyone is vulnerable, including athletes, right? Who are really healthy individuals, but they're vulnerable because they're using already their body, and challenging their body when they're outdoors, especially, and taking on physical activity. And then probably a lot of the populations you'd expect: infants and children's, older adults, outdoor workers, people who are pregnant, people with chronic conditions, and people without air conditioning, because you don't have that ability to help cool down your internal temperature without air conditioning. And then when it comes to heat-related illness, there are, again, more frequent and more intense heat waves. And then that increases the amount of heat-related illnesses. So you can see this number here: 13,042 cases of heat-related illness from 2000 to 2020. This was actually a great feedback from the presentation on Saturday that Mary Lou had just mentioned, that what one was, a lot of our numbers and data should be taken with caution, not because they're overestimating, but because they're probably grossly underestimating the true impact of heat-related illness, right? Every time that, for example, if one of us goes to our doctor's office or the emergency department for dehydration, it's not necessarily that every one of those dehydrations get counted towards heat-related illness. So we have to acknowledge that there's probably underreporting to a large degree when it comes to these numbers. And then how does extreme heat impact health? So I think I went over this earlier, that right, if you cannot sweat it out and you cannot kind of maintain that core body temperature, then there's going to be damage. There's going to be damage to your body, to your vital organs, including your brain, heart, and kidneys. And here's a Mayo Clinic paper that references it. And there's risk factors, of course, to who may be at more risk for impacts to their vital organs, like their brain, heart, kidney, and other muscles. And you see that isolation as one of them. This, I don't know that I have to go into all the details, but these are some of the heat-related symptoms that requires treatment. So, and it's an increasing severity. So first, to talk about heat cramps, which is an earlier warning sign, where you can and have an opportunity to really intervene here to prevent it from getting worse. You typically see people profusely sweating and having muscle cramps or spasms. And really what you want to do here is pause, listen to your body, move to a cooler location, right? Hydrate yourself. Of course, something with electrolytes is helpful, and then seek medical attention if they do not get better in an hour. And then the next kind of worsening step or condition is what's called heat exhaustion. And that's where you are, again, profusely sweating, probably more at this point. You're weak, you're tired, you have headaches, you're dizzy, maybe you're throwing up, maybe you're nauseous. If not, you may be fainting, and you're really, really thirsty. And you're so thirsty and you have so little fluid, you're so dehydrated that you cannot you can't go to the bathroom in terms of peeing or like urine output, right? And so that is a sign, again, to listen to your body, right? And if you're with someone, please help them go to an air-conditioned environment. Please help them lie down, loosen their clothing, get hydrated. This is, again, an opportunity to intervene, and you want to get their internal core temperature to cool down as quick as possible, including things like cold showers or baths, or applying cold wet cloths, and seeking medical attention, and having a low threshold to seek medical attention if symptoms do not get better soon. And then you have what's called heat stroke. So heat stroke is the worst scenario, and you do not want it, right? And as you can see here, there's different steps and stages. And so there are opportunities to prevent and intervene and recognize the signs and symptoms earlier upstream to avoid getting to heat stroke. And so heat stroke is where you're having a really high body temperature. This is where you cannot maintain that core body temperature, and then you start elevating that body temperature in measurable amounts. So when you take your temperature, kind of like when you have a fever, your body temperature is higher, and it's not just your body that's affected, your mental status is impacted. You're maybe in an altered mental state, you have a headache, you're confused, you're throwing up or nausea, you're dizzy. And then some people, you could see there, it says hot, dry skin, or profuse sweating. You can actually stop sweating when you're having heat stroke because your body kind of has shut down. It's so overwhelmed, you're actually not able to sweat anymore. You're not sending the blood to the extreme parts of your body so that you could hopefully sweat. And then you could become unconscious. So this is a true medical emergency. You want to call 911 as soon as possible, and then help them reduce their body core temperature as much as you can. And you see here like suggestions like cold bath, spray them with cool hot hose water. But you do not want to delay calling 911. You always want to do that first if you're the only one, or have someone else do that while you're doing the other interventions. And then you don't want to give liquids at this point. And you want to keep them safe, and of course turn them to the side, or maybe not of course, but turn them to the side so that if they are vomiting, that they're not gonna then swallow their own vomit by chance and choke or anything like that, or cause an infection into their lungs. So you want to turn them to the side. So this is another way just of really are showing you the same things that I kind of said earlier in the last slide, but it does include also heat rash and sunburn, which are other things to look out for, but earlier upstream things. Then in terms of staying safe, the general tips are to stay cool, stay hydrated, and stay informed. The good news is that we do have ways of getting informed. We do have ways to stay cool. And when you want to stay cool, if you know you're going to be outside, first try to limit being outdoors, or being in really, really hot areas, like being for example, leaving someone in a locked car when you're going outside, leaving your pets or kids or something. But of course, you want to, if you want to stay in an air-conditioned place, you want to wear light, loose-fitting clothing. Make sure you have sunscreen to minimize the impact of those UV rays hitting on you. And then I just wanted to talk about what are we doing as public health services. And by we, again, really kudos to Adrian and Gayla and many others who are taking the lead on this. So we have adapted, and the state health department has adapted a model from the CDC for California. And we are in line with that model and agree with that thinking. And so what that is called is the Cal Brace model. That is California's public health approach to addressing climate change, and BRACE specifically stands for Building Resilience Against Climate Effects. You see here that there's kind of 5 components that make up the BRACE model, and we call it CAL because it's a California adaptation of the BRACE model. So that includes forecasting the impacts of climate change and assessing vulnerabilities, projecting the disease burden, assessing public health interventions, developing and implementing a climate health adaptation plan, and evaluating the impact and improving air quality of activities. So those are all things that are kind of in our work plan. But again, we cannot do this alone. This is why we need to leverage and work and partner with each other, so we can continue to reach the populations that we can't reach, and to make sure to effectively implement this in a way that'll really protect our community. So we've done all types of things, of course, like getting the word out when just about dealing with heat. We have a whole group of nurses, for example, ready for media requests when it comes to heat events, things like that. We disseminate reports, we educate the public, we have response plans for the county, and that you could link to here. And then we have resources. A couple of years ago, the Aging and Independence Services Department, our sister department, used to operate the Cool Zone program, but this is not just something that is for older adults or needed for older adults. It's really needed for anyone who doesn't have access to air conditioning, right? And so we've taken over that program in public health services, and of course continue to work with partners like our Aging and Independent Services sister department. We even have started communicating to providers, and so we did our first health alert around heat this year, and really what they should do to keep patients safe during extreme heat events, including anticipatory guidance. And then just sharing some data we have from our EMS colleagues in the pre-hospital. So this is EMS fire department data. And just looking over time, you can see here, probably the thing to focus on is that the age range. You can see the peaks in terms of number of patients that they've seen peaked at the 15 to 24-year-old age group, and then kind of declined from there over time. And then the gender, 68% identified as male. And then, going backwards, you can see that they actually get cases throughout the year, even though it does peak around that kind of summer to fall timeline that you see on the bottom right. Then here, there's a lot of data again here, but I just wanted to point out that 1,000 of these individuals in this 5-year period were transported to the hospital, for example. 183 refused transport, and this is just one way of getting to the hospital. Many of us, will have family or some friends transport us to the hospital. So that data is not captured here, for example. And then you see on the bottom left that most of the cases were the green or the mild cases, but mild, I just want to underscore mild. We categorize that as mild, moderate, and severe or acute or dead on arrival, unfortunately. But mild is not necessarily mild, and I don't want to minimize it. It's just because it's still significant and important enough that people are calling 911, right? Even if the overwhelming number of cases are categorized as mild. And then you could see here that in terms of hospitals that people are transported to in our county, the number 1 was Sharp-Grossmont, which makes sense, and Palomar is number 2 based on the areas that they serve. And being most vulnerable to higher temperatures, like right now, where we know that in this heat wave that there are higher temperatures in our mountains and desert areas. And then you see the responding agencies. And here, though, is a great reminder that when you look at the incidents and where the incidents are, it's all around the county. And even though I talked a lot about kind of backcountry or North County and East County, and that you see a lot of incidents still in closer to the coast, and so we are all susceptible for heat-related illness. And here are some resources we just wanted to share for you. There's both resources for wildfire and smoke, and then also heat related. So this is the wildfire smoke. Please take your time to look at a lot of this. And tell us if you have any questions on others. And these are related to heat specifically, I think. Yes, mostly related to heat. And I wanted to, talk about also Cal Heat Score. So you can take your phone out right now and scan this QR code. The state has come up with a tool which we think is wonderful. It's called Cal Heat Score. We have our cool zone information in there. I know they're working on additional features, and like when you get an iPhone 1 versus an iPhone 5, I mean, that's two different hardware pieces, but the software, I'll say, or the app, so to speak, is going to be improved over time. And I know it's going to have proactive notifications and other things that they're trying to build out. So it's only going to get better over time. And I know the state is really looking at this as kind of their one-stop shopping app for people to know and be alerted and be aware of resources and take preventive measures, right? And learn about what they could do when it comes to extreme heat and their health. And then we also have a heat risk curriculum. I know many of you are here because you're interested in climate change and the impact. So some of you may be interested in, doing and learning from these 6 modules that we have freely available, accessible through our website. And then we rely on organizations like yours, like the League of Women Voters, to train residents. And you have access to different residents, maybe than a different CBO, community-based organization, and so we all need to be playing a role here to really make sure that all San Diegans are aware of the risks and take the proper prevention and mitigation strategies, right? And you do not need to be an expert. You just need to be passionate to do this. So, and with that, I will stop and pause for questions, and then ask, of course, Adrian and Gayla to please assist me if there's any questions I can't answer. I'll stop sharing.
Thank you so much. That was fantastic. Really, really excellent. I didn't say this before, but I really do need to say this. Sayone is replaced Dr. Wilma Wooten. So he's our main county health officer. And Sayone, we had Dr. Wooten come talk to us, and her presentation made such an impact on us. That's when we developed a little working group for the Heat and Human Health Summit. So
wow.
You all have tremendous impact on us, and we want to make sure everybody gets access to this important information. So I want to thank you before we start
Thank
taking
you.
questions.
I
And
appreciate that. And Dr. Wooten hired me 10 years ago, and so I still text her once in a while. So that means a lot coming from you, and just even putting me in that same category ish. So thank you, or us.
of
But
course,
we're all a team, and we're all mission driven, and just want to get the word out and help, of course. Thank
fantastic.
you.
Does anybody have any questions?
I see two. I don't know who's
Oh,
first.
Anne.
Meryl and Ann. Yeah.
Anne, you're on mute, I think.
I'm working on it.
Okay.
Okay, 2 questions. First of all, I was struck during your part on air quality. Well, first of all, let me say that was a really good presentation. I think we should share this video with anybody we can think of, and the newspapers and anybody else in the world I mean, it was just really good. Thank you very much for that.
Oh, thank you.
Getting to the questions now. First of all, on the air quality part, when a disaster is declared and a part of the county is affected, does the county do anything in the way of distributing masks or having, piles of them at libraries or places where people could go and get them? Because the mask seems like a really important thing. That's number 1. We'll do that one first, and then we'll go to number 2.
Yeah, I'm gonna phone a friend and ask Adrian if she knows about the masks in general. I know that we operate the cool zones and we have masks available there. But in terms of the more broader distribution, I'm not that I'm aware of, but
I'm also, yeah, not familiar, and we'll do some follow-up. I know our public health preparedness and response branch, they provide masks to like health facilities.
healthcare
But as far as going out to libraries, that's really great input, and we'll find out which department would be responsible.
Yeah, I think that would be a really good thing to do because apparently a lot of people are affected who aren't directly being burned, but they're also, well, anyway, all right, moving on.
Another, I think to your
Got it.
point though, sorry, Anne, is that, a lot of us have go bags and we always try to get the word out around having emergency preparedness plans and go bags. You don't know what type of disaster you're going to be dealing with. But if it is a wildfire or if you are impacted by air quality, we should have masks in your go bags. That is something we should all be thinking of as well.
Yeah, and you should be having people who are doing go bags, and good luck on doing that with everybody, would be my thought.
I totally agree with you.
Truthfully. Okay,
put that out.
second question. I read an article in the paper today that the Forest Service is not giving bags to firefighters who are out there fighting all the fires. And does the health part of our society have any concern about this, or are you trying to put any pressure on the government or anything? Because that seems particularly egregious to me especially after listening to what you just said.
Yeah.
And you say they're not giving masks, right? Not go
Yeah,
back.
they're refusing to give masks because then they would have to acknowledge, I didn't get the reasoning, and who knows if that's the real
Yeah,
reason.
I think I read that article, and it's the U.S. Forest Service does not require that firefighters as part of the Forest Service to wear masks when they're responding to the
But
wildfire.
they don't provide them either, Adrian. That was the part that
Correct.
blew me away.
And I think part of it is I was reading what the author was responding to in the comments, that some of the cons, but that it would reduce their workload by 20%, which is very egregious and upsetting. So yeah, I don't
problem.
believe that we haven't had a little huddle. I know that article just came out. There's also a comment that from someone who had previously worked with the Department of OSHA, or Occupational Health and Safety, that was tracking the registry for firefighters who had cancer or other sort of health symptoms, and a lot have been recently fired, and then 30% had been reinstated. So,
Oh, wow.
Crazy.
yeah.
Thank you. I would love if someone could share that article in the
I'll send
chat,
it.
please. 'Cause
It's
I
in
have
the
not
Union
seen that.
Tribune. It's in the paper today,
Okay, thank you.
or yesterday, Ann, right?
Yeah, I don't think so. I think it was this morning, but who knows? I read them all the time. It all
Yeah.
blurs.
All right.
Okay, thank you very much. I really appreciate that. Was a great talk. I really am glad I heard it, and I'm going to make sure it gets spread everywhere.
Thank you, Anne.
Thank you.
Beryl?
All right, I have two questions also. One is sports in schools. I know there's some kind of rules, but I don't think they're good enough.
Yeah, in terms of sports in schools, yeah, that was actually feedback at the Heat and Human Health Summit too, about what are we doing to outreach and work with them. And so I know we are internally huddling to follow up on some of the stuff from the other day, and we wanted to see how we could better outreach to a lot of the youth sports. During COVID, when I was in the Emergency Operations Center assisting Dr. Wooten and many others, we had some contacts with the sports community and youth sports community, right, around that we worked with very closely. So it might be that we revisit some of those contacts and then try to get to some consensus or just make sure that they're aware when the conditions are worse or when it's susceptible, whether it's high heat, temperatures, or of course wildfires or anything else.
My second question is, how far from a fire are people affected?
It totally depends
On the fire.
on the conditions of the fire, if it's how actively it's burning, if it's smoldering, and the wind conditions and the topography, if you will, of where people live. So hard question for me to answer. Maybe, I don't know, firefighter type of folks could probably respond more accurately than I can on that. I'm sorry. Adrian or others, if you have thoughts.
But is there kind of a general rule? I mean, I live in downtown San Diego. Should I worry about a fire 50 miles away?
In terms of coming and like evacuating your household, the
Oh,
way that
no,
they
no,
do
no. But I mean,
evacuating,
just
yeah.
being
But
outside, breathing the air.
air quality, maybe, I think is the answer. And it really depends on the, I'll give you an example. There were those fires, was it in Canada a year or two ago?
Yeah, right. It
That were
affected Chicago.
impacting, yeah, and that were impacting Chicago, and I think even New York City or New York
Yeah.
State,
Yeah.
so it, air travels. Like I said, there's no borders in our air. Right. So it just really depends on that actual incident.
Okay, thanks.
But I would monitor the air quality index.
Yeah, okay. All right, appreciate it. This is a great presentation. Thank you.
Ruth?
Yes, thank you. I just want to say fantastic presentation. And I'm so happy to know who replaced Dr. Wooten. I've tried to look it up on the website and I'm very happy it's you. So
Thank you.
thank you. Great job. To Burl's question, I just came across Canada and there are big fires in Manitoba right now, and the air smoke is all the way down into North Dakota, South Dakota, and Minnesota. So that's a long way, Burl, and
Yeah.
monitoring the air quality very carefully. So I have a comment. Another article in the Union Tribune today talks about the increased threat of wildfire in San Diego County because the National Weather Service actually issued a watch for La Nina, which is drought conditions, and we're under drought conditions already. So they're saying San Diego County could really have an increased fire season beginning now, if not now, definitely October, because that's when they say La Nina is going to set in. So I'm so interested in this WUI because I just read a really fascinating book on fire called Fire Weather that is just mind-blowing, but they talk about the WUI a lot. So does Health and Human Services, do you talk with the other county departments like land use and planning and who's giving out permits, and as we edge into the backcountry about how far the urban sprawl is, and also the materials that we're using for building, because so much of our building materials are petroleum based, which of course are very flammable.
You're right that is definitely something to be concerned about, and there's multiple, of course, interests in terms of providing more housing versus where we're building and how we're building, to your point, and the cost of if we use alternative, ingredients, so to speak, or building materials. So I have not, I'll say, since I came into this position and since May, talked to our land use folks around that. But there's a planning, there's a master plan for the whole county, as you probably know, and that's Sandag has a role. There's multiple other kind of governmental agencies that have a role, not just the county of San Diego government in terms of that master plan that's permitted, and so some of that is outside of even us. But those are important to address and make sure that people know. But I welcome other thoughts because I know I don't know everything, and I'm learning in this space in terms of are those assessments, do they include things like this? I know in some of the build outs or proposed builds that I've seen some of the arguments against that because for these reasons, which are very valid, right?
Right.
And even the fire departments and agencies saying like, hey, like we don't have fire departments close by and things like that. And if something were to happen, and you're saying you're going to build somewhere where there's an increased likelihood of something to happen, so all considerations. That's like a complicated math equation.
It is complicated, and you just want to know that the right hand knows what the left hand is doing.
Exactly. Yeah.
one agency isn't working against the work that you're putting out there.
Yeah.
So just an interesting point, I'll just share this with you. I just was camping in Oregon where they do field burning in rye fields
Yeah.
at the end of the season. So we camped at a beautiful campground. There was field burning nearby. The sky was black. There were ashes all over our car and trailer. And people in the campground were still building campfires.
Yeah.
It was appalling. The air
Right.
quality was hazardous.
Wow.
It was outrageous. But anyway, that's all. Thank you so much.
Of course. And just before going on, I wanted to say, you reminded me and I didn't speak to it, and we don't, as government, we don't promote one app over the other, but I'm not aware of any competing apps. So I will say that Watch Duty, if you haven't downloaded it, that is a great app, because they have people and it's mostly volunteer driven, of individuals who monitor the radio frequencies and then update on kind of the progress of certain fires. So you'll get immediate notification, visuals of the fire, visuals of the evacuation zone, things like that. I found that very helpful. I've had 2 fires that have been not too far from where I live in the last year. Rachel.
Yeah, if we have time, that was so exceptional on all the core things. And I know you were talking about vulnerable populations and this just mentioning the right hand, left hand. I was wondering on health conditions that may be a little bit more removed from just air quality directly, like migraine, which is a huge problem. How do we track that? Or are there orgs specifically tracking how that impacts with heat and other climate changes?
I would say, when it comes to heat related data tracking, it is hard, right?
Yeah.
You can go to 10 people can go to their doctor or provider for a migraine or something, but most people are not associating that. And even if you're coding it as a migraine, I don't know that all of that is being caught up. A lot of this really has to do with research and looking at this and kind of coming up with kind of what's called attributable fractions or ratios of okay, if we see this much increase in asthma during a heat event or poor air quality or fire event, we can estimate based on our research that this proportion are probably related to the event. It's kind of, to me, like how we say with climate change, it's hard to say that any individual event is associated with climate change, but when you look at the trend, there's definitely a trend. And so it's hard, like when I talk to my friends who are emergency department physicians, for example, they say that, okay, if you have 10 people that come in with asthma, during a wildfire, you don't know that every single one of those 10 are due to the wildfire. Right. And it's really hard to prove that. It's not like COVID where you have a test or a biomarker or something like that. So you really, that's where the research and stuff has to come in. And that's why I'm really being clear that all of our data is grossly underestimated. I think that the impacts are probably much greater than what we even realize they are. But we have a lot of good research to show that, we know that the things that are likely to cause harm, like particulate matter, we know from tobacco research and other research over decades that those cause cancer and other health effects. And then there's even other things that are in the wildfire. And we know that people, are inhaling this, which is a direct route of exposure, and so that they're going to be exposed and suffer from it. But to your original question about how do we tracking migraines, for example, or some of these other impacts that are maybe less obvious, I don't know that I have a great answer to that. I'm sorry.
That's okay.
And again, I welcome anyone else who may have a better answer to chime in, please.
Thanks.
So this is very new. I just wanted to know, just to give somebody a real world example here, we are entering an extreme heat event starting, I don't know whether it's starting today or tomorrow, but the LA Times just put out an article about this is the, warning
SoCal,
people
yep.
for all of SoCal. Yeah. So what do we look out for? So the county, the National Weather Service will issue these alerts, and then I know the Cal Heat Score is important in terms of how different and how concerning the actual level of extreme heat. But can you just walk us through what
Yeah.
might be happening this week?
Absolutely. So, thankfully, I read that LA Times article, and thankfully in San Diego, and I don't mean to say just, but it's not the whole county. It is kind of what's traditionally, unfortunately, more impacted, which is your valleys and mountain areas, and deserts and stuff like that. So where you see the temperature rising the most and more sensitive and to heat impacts. And so what we do, yeah, is we activate our heat group. And so our public health preparedness response branch has a list of not just internal partners, but external partners across the county. And if your organization, League of Women Voters, wants to be alerted, we can add you to the list so that you are aware whenever that happens. And then if you have people that, your community, you could tell, your listserv, for example, and spread the word so that, because if you have vulnerable people in your population that you want to look out for or things like that. And so just getting the word out is probably the most important thing, I would say, just that, hey, it is here, or it is here, and then when it ends as well. And so then also there's all the mitigation steps of, like, staying indoors when possible, wearing loose fitting clothing, maybe avoid the extremes, the hottest parts of the day if you do have to go outdoors, adjusting, taking more breaks if you're an outdoor worker, depending on who you are and what you do, so to speak, and the necessity to interact, be in places where you have to deal with extreme heat, then you may take different mitigation strategies. If you don't have air conditioning, we also activate our cool zones, which is a private public partnership with, we have our county libraries, which is another county agency, but then we also partner with a lot of community-based organizations that have places that they are willing to bring people in and host people in air-conditioned environments, because we know that's just so critical. The other thing to mention is that whenever you see that there's a heat wave where the nighttime temperatures are not cooling down, that should be a huge red flag to all of us, because that means that your body doesn't have the ability, you don't get a break in terms of trying to keep that core temperature. Usually when the nighttime cools, if you're in a high heat area, at least when it gets later at nighttime, your body has to do less work to maintain that core temperature. But now we're saying that the temperature is not cooling enough, that your body's going to continue to work overnight, which means you're going to be more susceptible to the impacts of extreme heat, because your body might just give out at some point, so to speak. And then, yeah, thank you, Adrienne, for putting in our cool zone program. So we have plenty of, I think we have 83 sites or something like that around the county. Adrienne, do you want to add anything? Oh, sorry.
Yeah, I wanted to ask a question. Well, you talked about a notification system of heat warnings. Is that on the county's emergency notification website that rings your bell if there's a fire or something going on in the county? Is that what you're talking about, or is it something different?
No, that's reserved more for, like if there is a wildfire right next to you, or some like another type of emergency. I would say for heat events that it is not done through that pathway. We do put out news releases and things like that, but we have an email that goes to all of our partner organizations as well. And then I think it's worth saying that we have a lot of San Diegans who English is not their first language, for example. So in that list, or maybe are from other cultures, and maybe they people receive information differently, or have different trusted community partners. So just like some of you all, or the people that you interact with, and so not everyone listens to government, and that's okay. That's just the reality, right? And so we do rely on these community-based organizations that are on that list to kind of get the word out. We have what's called Partner Relay, a group of individuals who work to help translate and things into other messaging and other languages, and in a culturally sensitive way to get certain things to certain populations as well. So
thank you. Okay, just for fun, could you pronounce your last name? I'm thinking, do we call you Dr. T? Is that what people do? I mean, I've tried to sound it out, and I don't even know.
That's totally fine. Honestly, you can call me Sayone, you can call me Dr. T. it's Thihalolipavan. It's Sri Lankan. And so, yeah, but don't
Yeah, Dr.
don't
T
hurt
sounds
yourself.
really good right now.
Yeah, I will respond to whatever, let's just get the work done.
Thank you.
Thank you so much, you all. We really, really appreciate this. It was fantastic. We are going to put this together to put on our YouTube channel and try to get it out to as many people as possible. It was so important to do that at this time, and your whole edition of the wildfire and smoke is fantastic. So thank you to all three of you for putting that together for us and taking the time. I know this is like really busy time of the year for you, so thank you for that too.
Thank you, Dr.
Okay.
Lindegren. But we appreciate you and having public health champion, by the way. She's being modest and she comes to us from the CDC. So we are so happy to have you, her and many of you as public health champions. Appreciate it.
Thank you. We've gone over here, so I apologize to everyone, and we will take all the updates at our next meeting. We might even just have an opportunity to just have us on the next meeting, because we really want to have updates and then talk further about our directions and strategy. So we'll get out to you our next meeting agenda. We will be sending out the list Rhea worked on, the legislative issues that have come up, and so we'll be sending that out in the notes. And Ruth, there was an incredible presentation at the Heat and Human Health Summit by about the Tijuana River crisis and some of the work that the San Diego Foundation has been doing. And so I want to make sure people can see that. They're going to post it all on the Pediatricians for Clean Air website. So I wanted to make that available. It's a really, really nice, really incredible presentation. We had a lot of incredible posters. I took a picture of a lot of them, but we're also going to hopefully have all of those up for people to look at as well. I also wanted to say that the League of Women Voters US has created a building not building electrification, but just a whole 54-page presentation, and that's shareable. Also a written format about how is electricity generated, just basically a education, which I think a lot of people could benefit from. And they're going to have a seminar. I believe I sent that out to everyone about this. And so if you're interested and can't find what I sent out, let me know and I will give you the link to that. It's coming up soon. I think you can link directly to this document now, but they're going to present it for the first time. So I just wanted to make sure everybody knew that. And does anybody else want to say anything before we sign off? Okay, everybody. Thank you very much. Have a wonderful evening.